My name's Prudence McLeod. I'm a descendant of the stolen generations and a Gurindji woman. I've been born and raised on Kaurna land, and I'm an Aboriginal nurse consultant for Aboriginal and Torres Strait Islander Health and Wellbeing Hub. My nana was a member of the stolen generations. She's Gurindji in the Northern Territory, which is about 16 hours from Katherine, and she was moved to Darwin and then Alice Springs and then down to Adelaide to a workhouse. With stolen generations, you're always going to be a little bit removed, and that's always sort of a challenging thing because you want to remain connected to culture and to country. My whole family, we're quite dispersed. Some of us live in Sydney, some of us live in Melbourne, some of us live here, but we've always wanted to stay connected, and that's how we've done that. After I finished nursing, I graduated from the University of Adelaide. I applied for a TPP here, and I was lucky enough to get 2 6-month rotations, so one in cardiothoracic surgical unit and the second in plastics and urology. So I was in the cardiac casual pool for I think 6 to 8 months, and then I got a permanent position in the coronary care unit. Cardiac is one of those areas that has a lot of Aboriginal patients and Torres Strait Islander patients, and so it was really important to me to stay in that space to be able to make sure that they had a really smooth journey. My role and the role that all my colleagues provide is that wraparound and community support that people need. It looks at their individualised needs and allows them to have that community of support to help bridge that gap and allow them to get involved in their own health. And that individualised approach is so important in Aboriginal health because every single person's different, their background's different, their individual experiences are different, and to be able to make that change for someone is just so rewarding. I continue to migrate back to Aboriginal health because it's an area that I feel I'm making the most change for my patients, reconnecting them back to their communities, reconnecting them back to their clinics, making sure that their health journey is as smooth as it can be in a foreign system. To be able to help someone understand their health journey and understand what's happening to them in hospital, but also give them the skills and tools to be able to go back home, teach others as well. Because when you're treating the person who's in the bed, you're also treating community too. I know that health and hospitals, we've done a lot of damage in the past, and we do a lot of damage to people on their individual journeys when we don't support them in the way that they need to be supported. So to be a person at the bedside through the whole patient journey until they discharge and even home, to be able to change that and make sure that they're getting a positive experience, that they're getting their health needs addressed, that they're going home and being able to tell people, I went to Adelaide and I got healthy, that's really important because that means that their family members are more likely to come down with less anxiety, less stress and get better outcomes themselves, and then that's all contributing to closing the gap.